Hi everyone, my name is Dr. EJ and welcome to my channel, Wavy Dog. Amazing. So first video on the channel, welcome. So I've actually been meaning to make this channel for quite a while now actually. Well, at least for the past year that I've been working as a doctor. But because of time, procrastination, and probably just a bit of laziness on my part, I haven't. But anyway, we're here now. So again, welcome. I'll probably make another video next or soon or whatever, kind of saying what I want to do with this channel, what the kind of videos are going to be about. But for the time being, I think we can kind of just get to the point of what this video is about. So again, let me just introduce myself again. So my name is Dr. EJ. I am a now foundation year 2 doctor working in the NHS in the UK. So I've just recently finished my foundation year 1 working. So the reason I've chose to make this video is because basically it's August. So we've just got past changeover. So all of the new doctors have just started working in the NHS for the first time as FY1 doctors. So whether that's coming from abroad or whether that's coming straight out of medical school, and it can be a very, very scary period of time. And because of that, I've had quite a lot of messages from people asking me about tips, asking me for some advice about things that I learned and how best they can approach the FY1 year. So of course I've obviously replied to those messages individually, but I thought it would be good to kind of make a video just kind of summarizing a few points that I think would be quite helpful from things people told me before I started, and from things that I've kind of picked up and things I wish I would have known back before I actually started FY1. All right, so let's just get to it. So the first point I want to say is be organized. And I know this probably sounds quite self-explanatory, but it's really, really important. I just really wanted to stress that point again. So let's even just talk about a typical ward day, like a typical ward day as working as an F1 doctor. This will involve you either kind of prepping a list first thing when you come in the morning of all the patients on the ward, and then kind of leading a ward round potentially, carrying out leading a board round, and then carrying out a full ward round either individually or with a consultant or registrar, and then kind of summarizing jobs that are needed for all of your patients, and then carrying out those jobs for the kind of the duration of the day, the bulk of the afternoon, early morning and things. Kind of touching base again with like a board round to kind of see what jobs are outstanding, and then kind of finishing the day with handing over any kind of urgent or outstanding jobs as well. You can see from that kind of thing I said so many different jobs here and there, kind of chucking all over the place. And one of the most important things that any kind of foundation doctor can do, and any F1 doctor can do, is make a list. And again, it sounds really, really simple, but a very, very clear, structured, prioritized list will kind of like make your day run so much smoother. So being organized in terms of kind of seeing which jobs need to be done immediately. So normally it's for like the most unwell patients. You kind of do those things early because again, patients are unwell, so they need things done because things can go south very, very quickly. And then after that, it's kind of doing any kind of urgent investigations that need to be ordered. So whether that's bloods, whether that's imaging, whether that's any specialty referrals that need to be made earlier in the day. And then following all of that is kind of like all of your admin work. So all your discharge summaries, your TTOs/TTAs, and all of that stuff that needs to be done. But again, probably not as urgent as the things starting right at the top that I kind of mentioned. So if you kind of make that list and structure it quite well, it'll kind of give a bit of structure to your day, and then it will kind of make you also feel a little bit better as you kind of work through that list bit by bit. And you know by the end of the day what's still outstanding, and you can kind of hand that over clearly and go home with a peaceful mind, knowing that you've done everything that needed to be done, and anything that is still left, somebody else is kind of dealing with on your behalf. Okay, so be organized is the first one. The next one, and I want to stress, is ask questions. Ask questions, ask questions, ask questions. So when you first start, you're not going to know the hospital, or you might do, but say if you're on placement there, or if you'd been before, but it's still going to be very, very new to you. Everything is going to be so new to you. So if you don't know something, ask a question. And the best thing to do is ask it early. So as soon as you have that kind of weird kind of feeling, maybe I'm not too sure about this, or I kind of know it, but I don't know it, just ask, just to be absolutely certain. Because If you don't and you make a mistake, then that's down to kind of you for not really kind of fully informed about whatever it could be. And right at the start of when you start hospital placement, the whole hospital knows that you're new. You'll say on your badge that you're FY1 doctor, so they'll know it's August slash September, and you're very, very new to the trust, very, very new to the hospital, very, very new to the job. So they have time, they have patience for you. So you use that to your advantage, because all you need to do is ask once, maybe even twice if you forget. But eventually, once you've asked and you've learnt it, then that's it. You've learnt that, and then you'll be able to do it every single time. And then what you'll notice, especially with an FY1 job, and even as a doctor as well, you just do the same thing over and over and over and over and over again, but just for different people. So once you kind of know something, you know it well, that would just make it easier kind of moving forward. But if you don't kind of set that good foundation, which is the whole point of it, like foundation year one, if you don't set that good foundation, then you'll be struggling for the whole year. And people were thinking like, well, what has this person really, really learned? Okay. And I think one quick point that I just want to say about that as well is that the whole job of being an F1 doctor kind of like is really just understanding the system that you kind of work in. So it will be your hospital or it'll be your trust. Every hospital is different. Every trust is different. There's different kind of systems in terms of how patients flow through the hospital, when they're seen, how to contact different teams, how to order different tests, the timings of the hospital, different things, all of that kind of stuff is all different based on your hospital. But once you kind of have a good understanding and grasp on that, things just start being easy. Because what you'll find as an F1 doctor as well is that you're more so in charge of kind of managing a patient's care, whereas the consultant or registrar is giving you advice, is consulting you, is giving you advice in regards to what the patient needs, but you are basically carrying out everything that patient, you're basically carrying out, so you're executing that plan. So in order to be able to execute that plan, you need to know what tools you have and be able to utilize those tools to the best way possible. That's by doing that, you have to understand the system that you kind of work in. The only way of doing that is obviously going to work, which you have to because you're on a contract now, day in, day out, and then asking questions of things that you don't understand. And then eventually you'll see, after the first 2 months, you kind of develop a very large bank of knowledge that will basically make the job a lot easier for you. The third point I want to say is be willing to work, and people will work for you, or people will work with you even, let me say. So the thing that I'm trying to kind of get at here is kind of utilize your MDT and actually be a very active member within that MDT. So as an FY1 doctor, you'll quickly find that you're liaising with so many different people. So whether that's pharmacists, whether that's dietitians, whether that's speech and language therapy, whether that's occupational therapy, whether that's physiotherapy, all of these people are going to be there first thing in the morning, seeing your patients. They're going to be there in the afternoon, seeing your patients. They're going to be there overnight, helping your patients. Sorry, I've been left out nurses as well, of course. And all of these people are paramount to getting your patient essentially out of hospital, which you'll find is the main goal for everybody. In terms of, obviously, a patient comes in, you want to figure out what's wrong with them, you want to treat that, but essentially you want to get them back to where they came from. And you can't do that by yourself as a doctor, but you have to do that with the whole MDT, because there's so many different circumstances and so many different factors that kind of lead to why a patient comes into hospital and how a patient can get out of hospital. So you need to be very proactive, you need to be kind, you need to be friendly, and you need to be aware of what is really going on for your patient and how all these other teams are kind of working in unison. And a lot of the time, you will kind of be like at the spearhead of that, because say, for example, if a family member comes in and asks about questions, maybe the therapy that you've been given, so in terms of whether it's antibiotics or whether it's steroids or whether it's any kind of treatment you've been given, could be coming to an end, but they may still need some physiotherapy to kind of build themselves back up because they've kind of been knocked off of their baseline for being in hospital for so long. Or they could be waiting for some equipment that they need at home from like occupational therapy or sorting out, things like that. But then they're coming to you to ask first off. So you need to kind of know exactly what is going on with your patient in each time. And what you'll also find as well is that your consultant will also be asking you, okay, so where are we with this patient? So obviously you have to know all of the investigations in terms of the treatment that you've been giving and how they're improving on that front. But then if there's anything else going on in terms of how is their mobility or how is their kind of baseline, are they getting back to that? You also have to be able to be aware of that. And the only way that you can do that is by being a very active member of your team, of the multidisciplinary team. Okay. So the next point I want to make is be safe. Okay. So this is kind of similar to the ask questions part, but I want to stress this one a bit separately as well. So so many people will say to you, and I'm saying this to you as well, is that only do things that you are competent in doing. Okay, so people will ask you to do things because you are a doctor, and there's such a vast number of things that a doctor can do. But again, everyone comes from different backgrounds, especially when you come in as an FY1 doctor. So whether you know how to do NG tubes or urinary catheters or kind of put in very like even cannulate, things like that, whether you know how to do all of those things, a doctor a doctor can normally do all of those things, but depending on your background, you might not be confident or competent in certain areas. And if that's the case, then be very, very honest and say, oh, I've actually not done that before, or I might have only observed it, so I'm not comfortable doing it independently. And let whoever's asking know, whether that's a nurse or whether that's one of your seniors, let them know straight away. And then what that does is that once you're being very, very honest with what you can and can't do, you can see where the gaps are in terms of trying to acquire that skill and trying to actually learn and develop your training. Because that's the whole point of the Foundation Year 1 program, okay? So just be safe. The next point I'm going to say is know why you're doing what you are doing, okay? So this is actually a very, very practical point. So you'll find, again, as an FY1 doctor, you're chasing up a lot of investigations that have been requested or that have been asked from by your consultant or registrar or someone senior to you. Because it's to help in terms of the patient care, to kind of really get to the bottom of a diagnosis. So say, for example, if somebody orders a CT, you can put in the order. But even talking from my experience, I did my FY1 doctor in a FY1 year, sorry, in a DGH. So we had to discuss and get nearly all of our scans vetted by the on-call or the duty radiologist. So you would go down to the kind of radiology department, and they would ask you, okay, so why do you want the scan? And I remember when I first started, I'll just be like, oh, well, this patient came in with this, they came in with this, and my consultant said I should do that. I did actually say that, and that's the quickest way of kind of getting kicked out, basically, because you need to know the indication of why you're doing the scan. Again, you are your own doctor, but again, if you're not sure, you have to ask your consultant or whoever requested the scan, okay, why are we doing this? One, to actually make it happen, in terms of giving a genuine reason, and two, also for your own learning, because if you're unsure, then again in the future, if you see somebody come with a similar presentation, you will know what you're looking for in terms of if you have to order this scan again. Okay, so that's essentially why you need to know exactly why you're doing what you are doing. Same thing comes with like blood investigations or specialty referrals as well. So I can remember so many times, especially when I started, you're calling different kind of registrars from different specialities, so cardiology or respiratory or gastroenterology, and you're kind of talking to them on the phone, and you just know the person on the end is just like, why are you calling me? And you need to know exactly what you're querying and why you need to get the other team involved. Okay, so again, if you're unsure, you might be absolutely aware, so that's absolutely fine. But if you're unsure, ask whoever is kind of, you ask your consultant or your registrar who's asking for this kind of investigation or this referral, because they'll probably just assume that you know what they're thinking as well. But if you don't, ask them, because then it will help your learning, and again, it will help you get that job done, which a lot of the time is really what you need to do. You need to get things done as an FY1 doctor. The next point is stay calm. Okay, so this is in a lot of scenarios, but generally throughout the whole of F1, just think, stay calm. Okay, so I've had loads of questions from like final year medical students and newly starting FY1 doctors as well, kind of saying like, oh, what do I do on call in like an emergency if somebody's new is scoring high on the new score, or the obs are all the way off and things like that. And again, I'll just say, first and foremost, stay calm. That's actually just the first thing you have to do, stay calm. And then you have to just go back to your basics. A, B, C, D, E, go through the whole thing in terms of any assessment, and you know that's kind of like your blueprint, and you won't miss anything. And that's just the basis of what's just expected of you as an FY1 doctor. You've all passed your finals at this point. You've all done your OSCE, so you have the knowledge, you have the skills already, okay? But in order to kind of translate that in the real world, if you can do A to E in any kind of acute situation with like an acutely unwell patient, any senior will be more than happy. You know what I'm saying? If you've done that assessment, even if you present in that way, in terms of the airways fine, the breathing's fine, in terms of circulation, that's all fine as well. Like, if you can present in that way, then they know that you're thinking and you won't miss anything in terms of what's really going to harm the patient, or what you can intervene on very, 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 very early, okay? But then also staying calm on kind of an on-call shift where you're covering wards and you're getting about 10 bleeps for every 5 minutes or something like that. You need to just stay calm, take the calls one by one, jot down all the numbers bleeping, call them back, and just prioritize what needs to be done and how quickly those things need to be done. Because the people calling you don't know how busy you are, but they just know that they need something done on their end. So if you obviously tell them, okay, I'll get to this, I've noted it down, but obviously I'm doing some wiser things, then that's absolutely fine as well, okay? So there's different things in terms of how you can kind of maneuver the system, but you have to just ultimately stay calm in all situations you can, okay? The next point I want to say is about your self-care and annual leave, okay? I was saying annual leave because I definitely this is something that kind of burnt me early on, and it's something that I would say to everybody, kind of book your annual leave early and be conscious about your self-care, be conscious about taking care of yourself, okay? So first and foremost, in terms of annual leave, book it early. So depending on your trust, again, the processes are different, but when I was working in F1, we would have to give a 6-week notice period for booking any day off as annual leave. And then obviously that needed to then be approved based on the staffing levels on the ward at the time, okay? I remember when I first started, I kind of ran in from August. I was just working. I was like, oh, and then people were saying, oh no, you haven't booked any leave. I was like, oh, fair enough. And then I remember when I tried to book it, there wasn't enough time, there wasn't enough staff. So I remember I ended up working the whole of August, the whole of September, and I think the first bit of leave was like mid-October. And I'll be honest with you, I don't think anyone should work that long non-stop with that kind of like actual break. And generally that's probably one of the only times I started feeling burnout, even in the years when I was kind of working for a very extended period of time without functioning those kind of regular breaks that I just needed for you to kind of refresh and relax and actually, you know what I mean, remember why you're doing what you're doing, so you have a bit of energy to come back with kind of like a new wave, you know, like a new wave of energy. So book annual leave early. And then in terms of kind of your self-care, this is obviously in terms of annual leave, but this is in terms of like a daily, weekly, monthly basis as well. So you have to be very conscious about your self-care and about how much time you kind of give to your extracurricular activities and things that your downtime essentially is what I'm trying to say. There's been times obviously that I remember throughout the year that I was very, very busy, and it was in kind of, when we're talking about this work-life balance, it was definitely getting a bit more work as opposed to kind of life, because I was kind of just focusing on work because I was on a really busy ward and things were happening always. I was going home thinking about work, waking up, going in early to make sure things were happening at work, staying late, this and that. And then I realized at the end of the week, it's like, wow, like, or I mean, at the end of the day, I was just like, wow, I don't think I've missed lunch today, or I don't think I've even drank water and things like that. And it's because I just wasn't consciously thinking about the life part of this work-life balance kind of, you know what I mean? Like, I was just letting work take control, and it will take control, because at the end of the day, you have to arrive in the morning, and when you're there, you have to do jobs that are given to you. So it can and it's never ending, let's be honest. So if you're not conscious about kind of making sure you're paying attention to the life part, to your social activities, to your extracurriculars, whether that's going to the cinema, seeing friends, playing sports, listening to music, or just coming home and watching TV, if you're not focusing as well on that part, then the balance will never be there. So I generally say is that in terms of how much effort and how much focus you put into work, I think you obviously have to put it to there as well, in terms of kind of really getting the kind of work-life balance, all right? So that's a really, really important thing, that there's been times in the year that I definitely did not do that, and I suffered for it, actually. I mean, I remember when I was literally like, I've never had to like, started the week and been counting down towards like the weekend and thinking like, oh my god, like I just need a break, I just need a break. But it got to that point, and I feel like that is kind of like leading, like getting towards burnout. And it's because I wasn't factoring in these regular breaks during the day, because I wasn't coming home and kind of like switching off and just kind of letting loose and relaxing. And I was just kind of just letting work kind of take control. So if I was to go back and tell myself something that I would do, and something I'm telling you guys as well, really focus on your life part as much as you're focusing on work, and that's how you kind of get this work-life balance. All right, the next point is a bit of more a kind of logistical one. So in terms of your portfolio, so as an FY1 doctor, I'm probably similar to what you guys have to do as medical students. You have like a portfolio that you have to fill out throughout the year, in terms of things that you have to do in each rotation to be able to pass your FY1 year. So the thing I would say about this, and I think I did actually, personally, I think I someone told me this before I started, and it helped massively. Just do it bit by bit, do it throughout the year, start early, and get things done as you're going, because then when it gets to the end of the year, you've got such a bank of things that it's actually just like, it's kind of effortless when you haven't got to worry about ARCP at all, yeah? So in terms of your tab, so tab is kind of your team assessment behavior, I think that's what it stands for. So that's where your kind of colleagues basically give feedback on you and how you've been working as a team. Get that done in your first rotation. Why? It's because you're fresh, you're bright-eyed, bushy-tailed, like you just started work as a doctor. You're being nice to everyone, and it comes, and it's very, very clear. So everyone's nice, and everyone will be nice to you, and you can get a very, very good tab from your first one. I'll be honest, literally by the end of the rotation, if you're literally trying to chase a tab, by your third rotation, of course you might still be nice, but again, like the work and the NHS will probably have a bit of its toll on you. You probably will be a little bit tired kind of on a day-to-day. It's kind of coming to work. You won't be probably as friendly. I mean, look, I'm just talking kind of in general. You could be probably the nicest person. That'll be absolutely fine. But I would definitely say try and get it done early, because then you know it's done, and that's all you need. You just need one tab for the entire year, and then that'll be done for your ARCP. Similarly with kind of CBD, so case-based discussions, SLE, so supervised learning events, and DOPS, direct observation of procedural skills. All of those things, kind of get them done bit by bit, because if you're collecting things as you're going and as you're going and as you're going, then you just create a massive amount of kind of evidence that you've actually been working. And also, if you're consciously doing that, then you're actually consciously looking for learning opportunities, so you know that you'll be actually developing your skills every day you go into work, every week that you're on a rotation. All right. And another thing that I'm going to quickly mention here, but I'll probably make a whole different video about it because there's so many points about it, is that as an FY1, you just, if you haven't already, because obviously people start from like medical school as well, but you have to start thinking about your future career as well. So in terms of kind of applying to different specialty programs and what you need to kind of boost your application and make your application strong, so that you can kind of get onto those programs later down, so after F2, after FY2. So what I would say is that if you know what you want to do, fantastic. Go online, look at the person specifications, and look exactly what you score points on. So say, for example, if that's kind of getting something published, or like writing a letter to an editor, get it done in F1, because as you become more senior, your responsibilities increase and your time decreases. So you have to try and just kind of get some things done as much as possible in FY1. I had friends who want to be surgeons, and they're doing their kind of MRCS like this year. So I have a friend that did it in F1. I have friends that are doing it just right now at the start of F2. So because in FY1 you have more time to kind of revise as well, so you can kind of pick up those skills quite early on as well. You know what I mean? And then similar to different things as well in terms of kind of like teaching. So if you want to organize kind of regional teaching or like a long teaching program, do that in your hospital, do it for the medical students that are there. And then acquire kind of like leadership positions as well, because all of these things score points. And again, it could be things that you're actually interested in. And in an F1, if you kind of do it then you kind of get those points from an early point, and then it will help massively later on down the line. So the next point I want to make is about apps. So these are apps that I genuinely used every single day. I was working as an FY1, so I can swear by them. And they're things that will just make your life so much easier. So the first one would be Induction. So this is an app where basically you, depending on your trust and depending on your hospital, it's a nationwide app, but the hospital uploads all of the different extensions for the different departments within the hospital onto this app. So you can basically go onto it, type in your hospital, and then you know exactly who to call in terms of to get down to radiology, or who to call to get down to the cardiology reg, or who to call to talk to hematology, etc., etc., etc. And it's just a one-stop shop in terms of just knowing who to call, and it's fantastic. And also the app lets you call from your phone, so you haven't got to always call from kind of like a kind of hospital line or anything like that as well. The next one that I'd say is Microguide. Again, you probably heard about this one. So, this is an app again that your hospital trust will upload all of its trust guidelines in terms of any antimicrobials that they use. So in terms of antibiotics, antivirals, and antifungals, that are kind of the trust or local guidelines. Because I know obviously you know that from like medical school, you would always say in OSCE, if someone has an infection, so I would check the trust guidelines, and I would prescribe according to these. Well, these are the trust guidelines. So Microguide will be your best friend in terms of prescribing for antibiotics. Because even though you've learned so many things in terms of theory and things like that, you have to prescribe what your trust prescribes for that. And this is kind of like a one-stop shop for that as well. Similarly, BNF on your phone, I'm sure, of course, you would have used it as kind of like for prescribing tests and everything like that. But in terms of having that quickly on your phone as well, just to double check any medications that you're not sure about is again a very, very useful app. And the last one that's probably not as common, but somebody recommended it to me before I started, and I really used it quite a lot in terms of kind of when I was on call a lot of the time when people were calling me for like like high news scores and things. So it's an app called Pocket Doctor, and it's fantastic. So it's got like these different sections, in terms of kind of what to do for like different news scores, and it's got like a rational prescribing part. So for all the kind of common things you'll be prescribing, so antiemetics, analgesics, sedation, fluids. I think it might have a fluids part as well. Just a kind of a quick one-stop shop, and kind of give you kind of the quick dosings that you need for these common things that you'll often use. And it's got some other parts as well in terms of like helping you interpret different kind of ECGs and radiology, and things like that. And then again, so kind of going back to when for the new scores, it kind of gives you kind of differentials of what all the different things can do, and then it kind of gives you kind of like a tick box plan as well. So when you first start off, and I used it when I first started off because when I was on call, just to kind of make sure I wasn't forgetting things, because it'll just be like, okay, so make sure you've ordered this investigation, you started the patient on this, and then things that you might not think of necessarily, and you can consider and just add to like beef out your plan. Initially, if you're seeing a patient for the first time, all right. And then lastly, again, it's a bit of a cliche one, or kind of like a cringy one, but have fun. Kind of looking back on FY1, I actually had a great time actually. I love my hospital. I met some amazing people, and kind of made some really, really good friends, whether they were doctors, whether they were the dietitians, pharmacists. I had a great time like working as a doctor. Again, the first month was really, really hard. Kind of learning the system. And what's actually interesting is that I was a medical student in my trust before, so I kind of did know the system a little bit, but it's so different from when you're just there, you have the responsibility, and you're dealing with however many patients, and it's short staff, and you're tired, and you're working long hours. So all of those different things you kind of have to get used to, because it is a very, very steep learning curve, and it is a very, very kind of big shock to the system. But kind of once I kind of got my head around what I need to do and how I get things done on a day-to-day basis, the job just was great, to be fair. And it kind of allowed me to kind of really make what I wanted of it. And I learned a lot about myself in terms of what I enjoy, and kind of the path that I kind of want to go down. And I think I did develop that during this year's FY1 doctor, because I experienced so many different things, whether it was an acute situation or whether it was just kind of routine stuff on a daily basis. I did pick up things and what I'm strong at, and things that I enjoy doing, and things that I'm not so strong at, and things that I don't enjoy doing that much. Anyway, okay. So on that basis, yeah. So those are kind of my pearls of wisdom, I suppose. My bits of advice that I've kind of acquired, people said to me, and and that kind of helped me get through FY1 and to now to FY2 year. All right. So I hope it was helpful. Again, if you have any further questions, obviously drop them in the comment section below. If you like the video, like it. It's a new channel, so subscribe. And yeah, also follow me on all socials. So it's _ Dr. EJ _. So that's on Twitter, Instagram, and TikTok as well. Yeah, so again, thanks for watching this video and stay wavy.